Acupuncture works in a similar way. Stimulation of acupuncture points in the energy channels called the meridian triggers the physiological response in the brain. The meridians are equivalent to the nervous network in the Western understanding of physiology. A simple explanation of how acupuncture works can be summarized as acupuncture can modulate the brain function through the stimulation of sensory nerves. Acupuncture points are located virtually all over the body along the peripheral nerve network. Scalp acupuncture is one of the acupuncture techniques that utilize acupuncture points in the head. It is a very effective acupuncture technique used to treat neurological disorders, especially paralysis due to stroke. Needling close to the brain may result in stimulating the cerebral cortex. Ear acupuncture is another style of acupuncture. It is an acupuncture system aimed at stimulation of the sensory nerves in the auricle to achieve a therapeutic effect. This picture illustrates one of ear acupuncture protocols called NADA protocol. NADA is abbreviation of National Acupuncture Detoxification Association. Needles are inserted in the points called Shenmen. In English, it means spirit gate, sympathetic nerve, liver, kidney, and lung points. In the mid-1970s, Dr. Michael Smith at the Lincoln Hospital in New York formulated an ear acupuncture protocol for the treatment of common drug addictions as an alternative to methadone. The selection of ear points proved to be extremely effective in the treatment of addictions and became what is now referred to as the NADA protocol. The NADA protocol is now used at addiction recovery clinics all over the world as a part of recovery treatment plan. Ear acupuncture is also used in the treatment of pain, anxiety, depression, obesity, and smoke cessation, to name a few conditions. Ear acupuncture is also used in the field of post-traumatic stress management at the disaster area for trauma survivors, staffs, emergency workers, and for veterans. Acupuncturists Without Borders is a non-profit organization offering free ear acupuncture services to disaster-stricken areas in the U.S. and overseas. Here is a list of commonly treated disorders by acupuncture: back, neck, shoulder, knee, arthritis pain, and sciatica, digestive disorder, menstrual disorder, PMS, menopause, infertility, allergies, asthma, headaches, migraines, alcohol, drug, nicotine addiction, stress, insomnia, depression, anxiety, post-traumatic stress disorder, obesity. Reflexology is another system of intervention in the nervous system to treat disorders. Reflexology is based on the postulation that the whole body can be represented in a part of the body. Reflexology utilizes reflex areas in the hand, foot, or ear, where a corresponding anatomical part of the body is supposedly represented. According to the theory of reflexology, through an application of proper stimulation in an active reflex area, disorders of the body can be restored. For an example, if a person experiences back pain, treatment is administered by stimulating the reflex area in the hand, foot, or ear corresponding to the back. That stimulation triggers the pain modulation mechanism in the brain to relieve pain. This is a hand reflexology chart. and this is a foot reflexology chart. Reflexology is a diagnostic as well as a treatment system. Problem in the body is normally revealed as a tender point in the reflex area. This can be used as an indication of some kind of disorder in the corresponding part of the body. This is the conceptual anatomy of an ear according to the ear reflexology. The ear reflexology chart is developed on the hypothesis that human anatomy can be projected in the ear like a morphology of an inverted fetus. Active reflex points can be detected and treated with a simple point probe. An electronic point finder and a stimulator can also be used. The stimulation of reflex area is associated with activation of an excitatory or inhibitory function of either sympathetic or parasympathetic nervous system depending on the site of stimulation. Also, stimulation of reflex points facilitates the natural self-regulating homeostatic mechanism of the body. It either diminishes an overactive physiological function or increases an underactive physiological function. Specific regions in the brain can be stimulated by the peripheral nerves in the reflex areas of the ear. Ear reflexology has a more powerful healing effect because nerves in the ear are in the closer proximity to the brain compared to the hand and foot reflexology. There are many different ear reflexology charts created by different schools. Location of anatomical parts are not always the same in different systems. In other words, a reflex zone is not fixed in one area. Reflex zone is where an active reflex point can be detected. This is a generalized area where you can locate a suspected reflex point for diagnosis and treatment. This is a simplified Chinese ear reflexology chart. Also, there are many functional reflex points that are not shown in this picture, which do not bear any anatomical reference as shown in this picture. This is one version of simplified French ear reflexology chart. This picture illustrates the zones of cerebral cortex and the spinal cord by the German ear reflexology system. According to the French system, the location of an active reflex point changes by the stage of a disorder. This picture shows the anatomical zones of internal organs in 3 phases. This is a Chinese ear chart that shows the major anatomical parts and some functional disorder treatment points. This is a German ear chart that shows the major anatomical parts and some functional disorder treatment points. This is an ear chart that shows the 20 most commonly used functional disorder treatment points. This is an ear chart that shows emotional and psychological treatment points. This is an ear chart that shows the zones of thalamus, hypothalamus, pituitary gland, hippocampus, and thyroid gland in 3 different phases. Antitragus is pulled outward to show a clear view of points located at the bottom of the ear. As you can see, there are many physiological functions accessible through ear reflex points. All these pictures show the extent of the studies done on the ear reflexology. Weight loss treatment involves selecting different reflex points depending on the etiology of weight gain. These are commonly used points for weight loss treatment: appetite control, stomach, liver, kidney, thyroid, pituitary, hypothalamus, Shenman, and anti-depression point. This picture shows the location of weight loss treatment points. This picture shows 5 weight loss treatment points. These are the location of points used for addiction treatment. Reflex point can be stimulated with many different devices, such as an acupuncture needle, an ear tag, an ear seed, or an ear pellet, an electrostimulator, or laser, or an acupressure earring. Picture of an ear acupuncture needle. Picture of an ear tag. Picture of an ear seed. Picture of an ear pellet. Acupuncture needles and ear tags are only allowed to be used under supervision of practitioners. However, ear seeds and ear pellets are safe to use by a layperson with a minimum proper training. Ear tags, seeds, and pellets are normally applied to the selected reflex points and are left there for a few days. This is an acupressure earring invented by Namjeon to substitute other cumbersome devices. Benefits of acupressure earring are no need to use acupuncture needles, easy to use and reusable, and a layperson can use it. It is also stylish and gives a look of wearing pierced ear earring. It comes in different sizes, small, medium, and large. Stimulating points near the center of an ear requires a large size earring. Small size earring is good for most of the points located along the edge of an ear. The book Ear Reflexology and Earring Therapy, written by Namjeon, explains in detail about ear reflexology and earring therapy. It covers many easy-to-use ear charts and treatment protocols. Book and acupressure earring are available through the website www.earringtherapy.com. Nam developed the earring therapy app for quick reference for ear charts and protocols. The earring therapy app for iPhone is available through the Apple App Store, and for Android smartphone is available at the Amazon App Store. The ear acupressure treatment procedures are: first, choose point to treat depending on disorders. Second, identify the reflex zone. Third, scan the zone to find the most sensitive reflex point with either a manual point probe or electronic point finder. Fourth, apply stimulation on that point with an appropriate device. This was the brief introduction of ear reflexology. Ear reflexology can be complicated enough for someone to make a career out of it. Actually, some physicians and acupuncturists do. Or we can make it simple and get the most practical use out of it. That was my intention when I wrote the book and iPhone app and invented acupressure earring, so that a layperson can easily learn and use it. Thank you for your attention. If you have any question, please email me to namjeon@sprynet.com. Thank you.